Assalamu alaikum warahmatullahi wabarakatuh. This is Dr. Faizal Fozan. Originally, I'm a dentist and I have a 1-year infection control diploma. This is one of the infection control dental education program lectures, which is medical waste management.
Medical waste management is one of the standard precautions. Routinely, dental facilities will generate variety of waste materials as a result of the treatment provided or even outside the dental clinic. That will cause the range for the medical waste to be from non-infectious to infectious, hazardous, or toxic. Although the transmission routes of these infections are still uncertain, but we have to take precaution during handling, storing, and disposing of this medical waste to minimize occupational risk to dental health care personnel, to reduce the exposure to the public, and to protect the environment. But who do you think is responsible for that? Well, actually, it's the responsibility of everyone. It's the responsibility for every person that works in the dental facility, ranging from the housekeeper, dentist, dental assistant, and everyone. But we have to put in our mind that medical waste must be managed and disposed according to the current waste regulation. Non-regulated and regulated medical waste in dental settings. Most of the waste produced during dental treatment is considered as general waste because it has low risk for disease transmission. That's why we dispose of it in the ordinary facility waste. Examples are the gloves, masks, gowns, lightly soiled gauze and cotton balls, and the environmental barriers that we use it to cover the equipment and services during treatment. On the other hand, OSHA regulated waste from the dental treatment facilities as infectious waste. It consists of the contaminated sharps, blood, or other potentially infectious material collected from the suction devices, or if the gauze and cottons are heavily soiled with blood and extracted teeth. An important point, during segregation of the medical waste, we must follow the national approved regulations. But there's a question, why do we segregate the medical waste? Because we don't want to put the general waste in the medical waste or the infectious waste to decrease the cost. And there is another point to decrease the cost is to use a reusable instruments rather than single-use instrument. Also, we do a segregation, which is an important point. We do a segregation to prevent putting the infectious waste in the general waste and prevent transmission of infection. Management of medical waste. The primary message in waste management strategies should take into consideration, first, protecting the environment from pollution, also to protect the individuals themselves, whether they are the dental health care personnel or the patient, and to protect the community. That is done by doing an effective and proper segregation, packing, handling, storing, transporting, and disposing of the waste, whether it's hazardous or non-hazardous. Another point is to minimize the production of the medical waste by doing a good segregation, as we said before. Doing good segregation will decrease the cost. Also, to ensure that the policies and procedure for the waste management are established, adopted, understood, and implemented by doing good training and by supervising the practice. So by now, we know that the waste that is generated from the dental centers are categorized into either non-hazardous healthcare waste, which is the general waste, or the hazardous healthcare waste, which is the infectious waste. First, we're going to talk about the general waste, the non-hazardous healthcare waste. This type of waste should be collected in black plastic bags. Also, it should be treated separately and segregated from the hazardous healthcare waste in all stages. They shouldn't be packed together, they shouldn't be collected together, they shouldn't be transported or stored together. Both of them should be handled separately. Now we're going to talk about the hazardous dental healthcare waste that include the infectious waste, pathological waste, sharp waste, and chemical waste. First, the infectious waste. As we said before, that most of the waste produced during dental treatment, like the gloves, gowns, apron, pips, gauze, cotton, the impression material or impression bites, the custom tray, they are all considered as general waste, unless if it was contacted with blood or body fluid from an infected person, then in that case we consider it as infectious waste. Also, if it were heavily soiled with liquid blood or other body fluid and it was dripping from it, in that case we consider it as an infectious waste. The second waste that we're going to talk about is the pathological waste, which is the waste that contains human tissue, like extracted teeth. This waste is considered as hazardous dental healthcare waste. The third thing is the sharp waste. The sharp waste, for example, like the needles that we use, glass vials, scalpels, orthodontic wires, endodontic files, broken glasses, or any other sharp object that has the potential to cut or puncture through the body. It is considered as sharp waste. The fourth is the chemical waste, which is the material used in cleaning and disinfecting or sterilizing procedure. It also includes the photographic and radiographic chemicals like the developer and fixer, the lead foils, and the waste amalgam. So, where should it be collected? Well, according to its type. If it's infectious waste, then it's collected in a yellow plastic bags bearing the phrase hazardous medical waste, whether in Arabic or English, with a biohazard logo. On the other hand, if it were a sharp waste, then it's collected in a yellow thick leak-proof, puncture-proof container to prevent the sharp from going through and causing any harm, with a phrase hazardous sharp item in English and Arabic and a biohazard logo. And before the collecting and transporting of the infectious waste, the bags and container must be fully sealed and locked, and it shouldn't be filled to more than 3/4 of its capacity and pressed. You should not press it. Also, there should be a data sticker on top of it to identify the content. One of the infectious waste that we mentioned before is the blood or other body fluids. Usually, we discharge it in the sanitary sewer or collect it in a septic tanks. So if we have containers with blood or saliva that is collected by the suction when doing the dental treatment, it should be treated and disposed according to the local laws and regulation. This laws and regulation will determine if we require any pre-treatment for this fluid and if it can be discharged in the sewer system. If it's permitted to discharge it, then we should do it carefully and put it down in the sinks, drains, or the toilet. If it's not permitted, then we should collect it in a leak-proof container, such as flasks or bottles, and close it tightly. During that, we should wear a full PPE, which is the gown, mask, protective eyewear, and gloves. One of the hazardous dental waste is chemical waste. Here, the radiographic fixture, whether the used one or the leftovers, and the developer solutions are classified as hazardous chemical waste. We must put in our mind that we cannot mix the used fixer and the developer, but if they were accidentally mixed, then we dispose of them through waste treatment and disposal facilities. So, how can we dispose of the hazardous chemical waste? Well, because of the high silver content in the fixer, we cannot flush it down the drain. It should be stored in a leak-proof container and then collected by a suitable licensed company or waste facility for material recovery based on national approved regulations. We're going to talk about other chemical wastes in dentistry, like the lid foils that covers the X-ray film, the protective lid shields, and the lid aprons. All of them are considered as hazardous waste because they are contaminated or have residues of a dangerous substance. So how can we dispose of them? Can we put them in the trash or the biohazard bags? Actually, no. The only way to dispose of them is using licensed or permitted waste treatment and disposal facility. Putting in mind that the lid aprons, whether they used or damaged, can be recycled, but we have to read the manufacturer recommendation regarding this matter. Also, we must get documentation from the company handling the lead waste to confirm that the waste has been disposed of properly. In each dental facility, a comprehensive program for safe management of waste material must be established. All the medical waste workers must know it, must know the content of that program. And also, they must be covered in this program. They must be covered regarding the vaccination that they should take and the type of training. The type of training for the medical waste workers must be in line with the work or the type of work that they provide. And the vaccination that they should take, one of the important ones is against the blood-borne pathogens. As we said before, training and education of medical waste workers should be specific to the type of work that they provide. So they should get training in risk associated with healthcare waste, segregation, handling, storing and collection of medical waste, proper management of spillages. So if blood, body fluid or any chemicals get spilled on the floor, what to do and what to use. The appropriate use of PPE, when to wear PPE, what to wear, how to wear it, and how to remove it. How to perform hand hygiene and when. The appropriate steps required for post-exposure to the sharps or blood or body fluids. Cleaning and disinfection, what to use and how to use it. Also, we must know when to get or perform training for the medical waste. Well, medical waste workers must receive the job-specific training on the infection prevention policies and procedures upon hiring, at least once annually, and when new updates and new guidelines are available that is related to their job. There are different waste supplies that should be available in the dental facility according to the type of waste produced. It includes waste collection containers and bags of different colors and sizes. The different colors to distinguish between the infectious waste and the general waste, and the sizes to accommodate the amount of waste produced. Autoclave bags. These bags are used to collect the highly infectious waste, such as the cultural plates, and then treat it in the autoclave. It must be made of a plastic material that withstands the high temperature without melting, and to enhance the sterilization process by allowing easier passage of steam into the waste. Other supplies are the sharp containers of different sizes. Also, the liquid waste containers, and the waste collection and storing trolleys. Also, we must have personal protective equipments and hand hygiene and disinfectant supplies. We're going to talk about some of the waste supplies in details. The first one, the containers. It's very important to segregate between the infectious and non-infectious waste. This segregation is the responsibility of the medical waste generator. That's why it's important to have different colors in containers. One for the infectious waste, which is usually the yellow, and one for the general waste. It will help if we put the two containers next to each other in the patient care area, so it will be easier to segregate between the wastes. As we said before, the hazardous healthcare waste generator must make effort to reduce the level of generation of hazardous healthcare waste both in quantity and quality, and that is done by segregating it properly. Why? Because we don't want to increase the costs. We don't need to put the general waste in the infectious waste. All the containers should be easy to clean and made of material that can be disinfected. Cleaning and disinfection of container should be done following the policy of the facility. Also, we should choose the right size of container. The size must accommodate the size of the bag used and the amount of waste produced. To prevent contact of the waste with the open air, the containers should be covered. Also, we prefer that it is operated by foot so that we don't touch it with our hands. A color coding system should be established to differentiate between the general and the hazardous healthcare waste. For example, we could use a black color for the general waste and a yellow color for the hazardous waste. A statement, hazardous medical waste, is written on the side and cover of the container with a biohazard logo. One of the important waste supplies are the sharp containers. Sharp waste such as blades, needles, or syringe are disposed of in a yellow, thick, leak-proof, puncture-proof container. It should be thick enough to prevent the sharp from going through the container and causing any harm. When using the sharp container, we should leave it open. But when we're finished and we want to transfer it to the storing area, it should be closed. That's why it should be closable. There should be a phrase written on it, hazardous, sharp item, both in Arabic and English, and also a biohazard logo. An important point is that the needles must never be recapped, bent, or broken by hands before being discarded and put in the sharp container. The exception here is the dental local anesthesia needle. We recap it before placing it in the sharp containers. The sharp containers are well mounted either on the wall, at the eye level, or above it a little so that we can see the opening and not causing any harm when we put the needle inside. Or it could be placed on a stand away from the patient and children. It's preferred to be located at the point of use. The size of sharp container is used according to the amount and type of sharp waste produced. So if we are producing a lot of sharps, then use the big size. If not, use the small one. Which we mean by them, the sharp containers are labeled with the date and place of production after being closed and transferred. We're going to talk now about the bags that we put inside the containers. Like the containers, we have two different types of bags, one for the infectious waste and the other one for the general waste. The one for the infectious waste should be a single leak-resistant biohazard yellow bag. It's used for the non-sharp regulated medical waste. There should be a phrase written on it, hazardous medical waste, both in Arabic and English with a biohazard logo. On the other hand, the general waste should be placed in a single leak-resistant black bag. Now, do we use a single or a double bag? Well, we only use one bag. The use of a double bagging is not necessary unless the integrity of the bag is jeopardized, whether it's cut, or the outside of the bag is visibly soiled. In that case, we put it in another bag. All bags, whether the biohazard or the general, should be securely closed for disposal when they are 3/4 full. Why? Because you want to leave a space to close the bag. The medical bags, as the sharp containers, are labeled with the date and place of production after being closed and are prepared to transporting. Now we're going to talk about a different type of bag, which is the autoclave bag. The highly infectious waste will be collected in plastic bags suitable for pre-treatment with the autoclave. It should withstand the heat generated from the autoclave. These bags will bear the phrase high infectious waste and the biohazard logo. After the pre-treatment, then take it out of the autoclave and place it in another bag. It's a yellow bag bearing the phrase hazardous medical waste both in Arabic and English and a biohazard logo. At the end, a sticker should be attached on both the bags and the sharp containers. The sticker will contain the following data: the facility name, the word name, generated waste type as per its classification, the weight and quantity of waste in the bag or container, the date and time of collection, transportation date and time to the disposal facility. All the labeling stickers that is attached to the bags or container must be of a proper size and written in a waterproof and permanent ink. We already talked about the first step in the right way to handle medical waste, which is waste segregation. Waste segregation is a very important step. It's done by the medical staff at the point of care, where they segregate it to the infectious waste and general waste. The second step is the collection and transportation of the medical waste. The collection and transportation of the bags or containers of the infectious medical waste require the use of special trolleys or carts and a well-trained staff to guarantee the highest degree of safety. Some of the characteristics of the trolleys or carts are they should be of adequate size so they can accommodate all the bags at once, with no sharp edges so that they won't cut the bags. Also, they should be cleanable. You can clean it easily, and it should be easily moved, tightly closed, because when you put the bags, you should close it tightly when you are transporting it throughout the center. It should be leak-proof, so no liquid will be leaked on the floor, and clearly labeled with a biohazard logo. Now, the medical waste worker, when they collect and transport the medical waste, should wear a proper PPE. We want to know when to collect and transport the medical waste. It should be collected regularly, meaning once every clinical session, once after the morning session, and once after the afternoon session, or as often as necessary, meaning that at the same session we can collect it more than one time, depending on the amount of waste generated. And then you transport the medical waste to the central storage site or waste transfer station. After that, you transport it outside the dental center. The bags or container, and this is a very important point, should be replaced immediately with new ones of the same type after collecting the old ones. So when you collect the bags, you should replace it immediately with another bag, because you don't want to leave the site without a waste container. When collecting and transporting the medical waste, it should be handled properly. So don't hold it close to your body to protect your clothes and skin, and don't carry it from the bottom. You should only carry it from the top. And then when the hazardous healthcare waste spills or leaks out of the plastic bags, containers, or trolleys, such waste must be considered as highly hazardous. This requires immediate action. You must contain it, then clean and disinfect it following the right steps. You will find these steps in the environmental cleaning lecture. Trolleys or carts for the collecting and carrying of the medical waste must be cleaned, washed, and disinfected on a daily basis or after each use, according to the need. You should disinfect it with an appropriate disinfectant, and it should be done in a special location. You cannot clean it and disinfect it anywhere. It should be done by a trained staff under the supervision of the person responsible for the hazardous medical waste within the center. When handling medical waste, first we segregate it to infectious and general, then we collect and transport it. The third step is storing. Storing is done temporarily inside the dental facility in a designated area, room, or building, but it should be of adequate size. The size should be appropriate to the quantities of waste produced and the frequency of collection. But if the dental facility lacks space, then daily collection and disposal should be enforced. We said before that the infectious waste and general waste should be separated on all the steps. They should be segregated and then transport, collected, and stored separately. But if we don't have this luxury, if we only have one storing room, then there should be a hard barrier between the infectious and the general waste. Don't mix them together. Some of the dental facility, they don't have an area inside the dental center for storing the medical waste. They have it outside the center. It's okay, but there is one condition. It should be securely closed. Where can we store the medical waste? Can we store it anywhere? Well, actually, there are some requirements needed for the storing area or room. It should be of adequate space. It should be big enough to accommodate all the waste produced from the dental clinic. It should be located within the dental facility. But as we said before, it's okay to be outside the dental facility. But it must be securely closed and only authorized people can enter it. It should be located away from dental clinics and direct patient care area, laboratory, and so on. It should be easily accessible for storage, transport, and cleaning. It should be equipped with safety and fire protection tools and emergency kit. It should be equipped with proper lighting, ventilation, and air condition, with temperature monitoring. The temperature shouldn't exceed 18 degrees. There should be a hand washing basin with soap and tissue. There should be also a source for clean water to clean the floor and a sanitary opening so that the water goes inside it. The walls and floor should be covered by material easily to be repeatedly cleaned and disinfected with approved disinfectant. And the angles should be curved so it's easily to be cleaned. It should be equipped with necessary PPE that we use in handling waste and cleaning. It should be equipped with waste bags or containers. It should be equipped with cleaning tools and supplies that we use it in cleaning the area and spills. The entry should have a clear hazard sign that states the storage content, both in Arabic and English. For example, caution, biohazardous waste storage area, unauthorized person, keep out. The door should be locked, well sealed at all times, with access control allowing only authorized people, which are the medical waste workers and supervisors. It should be managed by competent personnel specialized in handling hazardous healthcare waste. Only store the waste that is filled in the recommended containers or plastic bags. Never store irrelevant items in that area like personal belongings or food items. So only relevant items and required supply are kept inside the storing area. The last step in handling medical waste is transporting of it outside the dental facility. The infectious waste must be packed and labeled correctly and handled only by licensed persons. Any infectious waste being delivered for transport outside the institution will submit a copy of the complete hazardous medical waste manifest form to the waste treatment and disposal facility, identifying the type of waste delivered for disposal. This facility should have a valid license obtained from a competent authority. The related hazardous medical waste manifest form and any other related documents like reports will be archived for a period of 10 years. Here, by MOH, all the medical waste should be transported outside the facility within 24 hours. Extracted teeth and how to dispose of it. Extracted adult and deciduous teeth are considered as human tissue and are considered regulated medical waste. According to MOH regulation, they are disposed according to the presence of a filling. If the tooth extracted does not contain amalgam filling, then dispose of it in black bags. But if the tooth extracted contains amalgam filling, then it should be disposed of in amalgam containers. The reason for that is because the dental amalgam contains silver and mercury, which are both considered as hazardous waste. That's why the extracted teeth containing amalgam should not be flushed down the drain or placed in general or medical waste container, because this type of waste may be incinerated or placed in landfill, and that may cause contamination of water, air, or soil. Some of the extracted teeth can be used in educational settings according to its status. If the extracted teeth is used in the preclinical educational training, it should be first cleaned of visible blood and gross debris, then use service disinfectant and maintain it in a hydrated state, meaning it shouldn't be dry, it should be immersed in a solution. Put it in a constructed container. This container should be labeled with a biohazard sample, and it should have a secured lid to prevent leaking during transport. If teeth does not contain amalgam, you can heat sterilize it in the autoclave, and you can use water or saline as storage solution. But if the tooth contains amalgam, then do not sterilize it to avoid mercury evaporation and exposure. So in this case, the tooth is not autoclaved. What can we do? We can immerse it in 10% formalin solution for 2 weeks. That should be effective in disinfecting both the internal and external structure of the tooth. But of course, use caution when handling teeth that have been preserved in formalin. Extracted teeth and dental laboratory. Since liquid chemical germicides cannot reliably disinfect the extracted teeth, sending them to a dental laboratory for either shade matching or size comparison should be avoided. If necessary to do so, then you must first clean the teeth from visible blood and gross debris and then use service disinfectant, intermediate level disinfectant. After that, transport it in a leak-proof container labeled with a biohazard sample. The laboratory personnel should wear gloves when handling these extracted teeth, and when they are finished from it, they should either dispose of it in a regulated medical waste if there were no amalgam filling, or either return them to the dentist in a biohazard label container for disposal. If the patient asks you to have his extracted tooth, whether it contains amalgam or not, you can give it back to him. But you should clean it of blood and gross debris and then place it in plastic bag or other sealed container before giving it back to him. And you should advise him not to open the container or discard the tooth until they return home. As we all know by now, dental amalgam can contaminate air, water, or soil if not handled properly. and that may harm the humans, animals, or environment. So in order to prevent that, the amalgam waste, the amalgam capsules, and the extracted teeth that contain the amalgam restoration should not be placed in the infectious waste or the general waste. It should not be flushed down the drain or toilet. And any devices containing amalgam should not be rinsed under running water, over drains, or sinks, as this could introduce dental amalgam into the waste stream. All the amalgam waste should be stored in separate, appropriately labeled containers. These containers should have a wide mouth. It should be covered, well-sealed lid, rigid plastic container. All dental practices which places or remove amalgam filling must install chairside traps, vacuum pump filter, or amalgam separator within the dental unit filter, and ensure that the amalgam collected is disposed of as a hazardous waste. Line cleaners that minimize dissolution of amalgam should be used. And there is an important point that the use of bleach or chlorine containing cleaner to flush wastewater lines should be avoided. Amalgam waste should be collected by suitable licensed or permitted waste management facilities, where the waste undergoes a mercury recovery process prior to the final disposal. In conclusion, all the waste that is generated in your dental facility should be segregated and discarded according to the local regulations. So according to our local regulation, the blood-stained and saliva-stained items are not considered regulated medical waste, so we dispose of it in the general waste, while items saturated with blood and or saliva are considered regulated medical waste. That's why we dispose of it in the infectious waste. The containers with regulated medical waste must be labeled with the appropriate biohazard sample, and the used needles and other contaminated sharps must be placed in a puncture-resistant, leak-proof container that is closable and contains a biohazard label. Extracted teeth containing dental amalgam shouldn't be placed in a medical waste container that uses an incinerator for final disposal. It should be discarded into amalgam containers that are closable and leak-proof and contain a biohazard label. Thank you for your listening, and please don't hesitate to contact us for any question.